I want to tell you a story. I want you to imagine what it feels like when you no longer feel like anyone loves you, or when thoughts come into your brain that keep you from being able to trust the people that you should be able to trust, which is your family. The pain that that brings to people is enormous. The fear that they live with every day hinders their ability to engage and be who they were meant to be.
People with mental health issues, behavioral health issues, psychiatric issues, however we want to classify them, are largely misunderstood.
It's hard to look around us and not realize that this population is an underserved, vulnerable population that we have always been in the business, but could do better. And of course, I think even our state and our country needs to be better in this space, because I think the alternatives for not properly treating and caring for patients who need behavioral health services just is unacceptable. I don't think you can be providing care to this patient population without just having your heart broken on a regular basis about lack of services across the community.
I am very excited to have a dedicated behavioral health center where we can really tailor and carefully welcome our patients and their families who are seeking behavioral health care. It provides us an incredible opportunity to create an environment where patients and their families can feel safe, have the confidence that they're working with experts who are dedicated to their successful treatment, and that we are their place to come at any point in their care continuum if they should need help and assistance.
The setting that someone comes to for treatment is as important as the treatment that they're seeking. You cannot do one without the other when you're dealing with people. And so in order to have a truly beneficial place for people to get treatment, we had to start from the ground up. And that's what we did in this building. We started from the ground up with what we know about people and what people need in order to ensure that we could treat people in the best place possible.
Here, this behavioral health center provides an opportunity of a multidisciplinary approach. We'll have psychologists, nurses, psychiatrists, social workers, a number of team members across all of these services working very carefully together to ensure that the patient and their family have a seamless continuum of care at our new center.
One of the things that we are so excited about with this building is that we have co-located services that people had to go many different places for in the past. We have the ED, we have the outpatient clinic, we have the inpatient unit, we have ECT. In the past, people, just the transportation to and from appointments was an added stress that you have. When you come to us, we are here.
This building represents acknowledgement, because there is a need, and this population has a right, a fundamental right, to be treated with respect and dignity.
You know, I often share that the decision that the health system made to build this building was one of the most mission-driven decisions that I've seen us make.
I am so proud that the health system is making this investment for our behavioral health center. It shows a commitment to this area of need. It shows a commitment to the Durham community, and it shows a commitment to our Duke Health System members that we take it very seriously, the need for behavioral health.
It's just a mark of our health system understanding that we're doing this because it's what patients need. It's what our community needs. It's what we need for each other. The amount of people that have come together for planning and the execution and pulling all of this together it's been remarkable, and it's just an immense amount of people from all over the health system. We have residents and the residency training program from Duke University Hospital. We have nursing from both units. We have our emergency department colleagues from Duke Regional and main campus that have come together. Infection prevention and pharmacy and materials and security has played a key part in this, and food services. It's just, the list goes on and on. We could not have done it without everybody really coming together and working together and making great plans for this new building.
People are people. No person is only a diagnosis. No person becomes their diagnosis. I don't want anyone to stop being themselves. I don't want anyone to let go of their dreams. I don't want anyone to believe that they cannot reach every goal that they have just because they have an illness. And in this building, our intent is to make sure that every single person who comes here and every single person who leaves here knows that they are a whole person and that they should live their dreams and set their goals as high as they would like them to be.
We need to provide for one another the space, the grace, and the place to be able to fully be who we are, to fully feel everything that's going on. To be able to be vulnerable, to be able to be sad, to be able to be angry and not feel judged or vilified. And so in giving that type of space to one another, this building is a physical representation of what we should be offering one another.
We do this work because each and every person brings value and grace to this world. And if things are hurting you and keeping you from being able to do that, then we want to make it so that you don't suffer. That's why we do what we do.